Power. This is the day that the Lord has made, and we have no choice but to be glad in it. We thank God for our life, our health, and our strength. We thank God for the day that He has made. We thank God for the things that He has done. We come to you live from the store of Healthy You. We thank God for um, the season that we're in, the season of Thanksgiving, and we just thank God for being alive. This is a wonderful time to be alive. It's a wonderful time to share the goodness. This is a wonderful time to give God praise for the wonderful things that He has done, and we don't take that lightly. And if you can hear my voice, I say it all the time, but if you can hear my voice, then you owe God a thank you. Again, we thank you for tuning in to the Hour of Power. We come to you live from the store of Healthy You. All is well here, and we hope all is well at your house. We love you, we miss you, and we want you to know that we're thinking about you. Please, at this time, take this moment to like and subscribe. Tell your friends, tell your family that New Jerusalem Television is on, and we thank God for you tuning in. Again, as always, we thank God for my wife, my beautiful wife, and my beautiful mother being with us. We have been talking for the last 9 months, I guess, or something of that sort, about the coronavirus, and we just want to educate and inform the people of God of some of the things that they're not saying and not telling us. And so we just thank God for you. At this time, let's have a word of prayer. Heavenly Father, we thank you for this day. We thank you for this time. We thank you for our life, our health, and our strength. We thank you for this time that you allowed us to share. God, we ask that you be in everything that we say and we do. And then, God, we be so ever careful to give your name the praise. These things we ask in your name. Thank God and amen. Again, thank you for your time. Thank you for your prayers. Thank you for your support. Um, we are here for you to help inform the people of God of the things that is going on in our society. Um, this is the time that we live in, and I believe that we cannot act as if everything is normal. Everything is not normal, and so we have to govern ourselves accordingly. And along with that, we definitely consult God. We definitely acknowledge God, and we pray for insight and direction. And again, the only way we can make it through this is through the hand and the help of God. And so we hope that we are that bright point of your day. We hope that we are that spot of good information that you can have and use and apply it to your life. And so before we start, thank you all for coming. How was your Thanksgiving?
It was good.
Good, good, good. How was yours?
Relaxing and quiet.
Good. And we trust that you all had a great Thanksgiving. It was a little different, but we made it through.
Mm-hmm.
And the fact that everyone is here and alive and healthy is good for me.
Mm-hmm.
And before we go into our subject matter for today, I wanted to again acknowledge you all, our viewers. If you have any comments, any questions, any concerns that you have over the last 9, 10, this is December, or over the last year, please write it in the chat room. Any questions that you may have, any concerns that you may have. Um, we do have some questions from the viewers that we're going to start with. Um, but if you have anything that you want to ask, we have a doctor on staff, and so we would do our best in answering your questions as best as possible. Um, One of the questions we had from our viewers is, what is it is or are?
Mm-hmm.
I sound like mommy now.
Let's hear the
What
rest.
what are some medicines that we can have at the house uh, that we should have on hand if anything happens? Um, to boost our immunity, to strengthen, or if we have some symptoms, what are some medicines that we can have
Sure.
at the house?
We talked about some of the natural things, but some of the things that they're given for COVID is zinc. vitamin C, and then you want to have Tylenol for the fever, just in case you have a fever associated with coronavirus. You want to be sure to control that. So you want to have fever. And then something like Gatorade or Powerade. A lot of people who have corona are getting diarrhea and dehydrated. So you want to make sure you have something to rehydrate yourself. Of course, hand sanitizer is a side note, not a medication, but something that you should have just in case you need something nearby. Versus getting up and going to the bathroom to wash. A thermometer, you want to make sure that you know what your temperature is, because the fevers can get pretty high and dangerous. So you want to have a thermometer on hand. Anti-diarrheal medication. Again, the diarrhea can get pretty severe with coronavirus with some patients. So you want to have something to control that. Cough medications, cough suppressants, such as Robitussin or Delsum, and also cough drops just to soothe the throat, because you can also get a sore throat with that. And then teas with honey and lemon also are very good during that time to help you with the symptoms. So the biggest thing that you're going to do at that point is control your symptoms. And then, of course, good old home fashion soup. Mom talked about bones too, and the nutrients and with that, and vegetables and things like that. Anything you want to add?
No, but I did want to ask. I've talked to several people and they had a temperature of 101. When is it dangerous?
Well, it depends on the person, but 101 is where they start to say it's a marker indication that you do have you could potentially have COVID. Anything less than that is considered a low grade fever and not considered dangerous. But when you get up to the 103, 104 range, you need to go to the emergency room, because especially if you're taking something and it's not coming down at all, that's getting dangerous and can be damaging to the body.
And again, would you agree that you need to know your body? Some of us is coming off of allergy season. So you need to know your body. If you wake up with the sniffles or a sore throat, don't panic. Because this also comes with the times and the territory.
Right.
So stay calm, stay cool, stay collective, and don't panic.
And along with that, you want to make sure you have your normal maintenance medications for your hypertension or your diabetes and things like that. Don't get down to 3 or 4 pills ever, because you may come down with coronavirus and not be able to go out and get more medication. You want to make sure you have that stuff in the home, so that you can manage your underlying health conditions, because you don't want those to get out of hand while you're focusing on this coronavirus.
So it's a good idea to have a 90-day supply.
Absolutely.
And if you need the 90-day supply, we can take care of you here at the Healthy You Pharmacy.
There you go.
Just give Sister Jada a call and we can make sure you have your medicine,
Absolutely.
even if you live in a different town. Along with that, then, we have some questions about what should you do if you're around someone that tested positive. Let's start there. So what should you do if you're around someone that tested positive?
Okay. So there's a few things that you take into consideration: the length of time that you were around that person and the proximity you were to that person, because the closer and the longer you're around that person, the more likely it is that you can become infected with the virus. But the first thing you should do is it's recommended that if you come into exposure to coronavirus, you should quarantine yourself for 10 days, because it takes 3 to 5 days. Don't go run and get a test that day or the next day. You should wait 3 to 5 days to go get a test. Anything less than 4 days, there's about a 67% chance that you're going to get a false negative. So if you go day 1, 2, 3, or even potentially 4, it's 67% chance you're going to get a false negative. And then you're going to go about your way thinking that you're not carrying the virus, but in our actuality, you just haven't built up the antibodies and started shedding the virus yet. So if you're asymptomatic, that's how long it takes, 3 to 5 days for you to test positive. If you're symptomatic, you're shedding the virus because it's already, caused an immune response. So you are already going to test positive.
Okay, so I take the test. I wait the 35 days, take the test negative, still feeling bad.
You should retest.
When?
I would wait because remember we talked about it early on, and this could be different viewers, so it's always important to revisit. This virus can start to show itself 2 to 14 days after exposure. Most people start to see things at day 5. So that's why you have people testing falsely negative in that beginning, because they may be among the group that don't show symptoms or don't test positive to 10 to 14 days after. So that's called the incubation period.
Are you contagious then?
You can be, because remember, some people are asymptomatic. So once you start to test, and it also has to do with the accuracy of the test that you're dealing with. So there's a lot of factors at play, and that's why they just recommend that you go home and you quarantine for 10 days, because you may feel great, you may test negative, and then at day 10, you start to see things. And you've already spread it. So it's very important that you pay attention and you follow that's the CDC recommended guidelines if you've come into contact with someone. Now think about that. How many healthcare providers or public workers are dealing with patients and don't know they've been exposed, or are still working because they feel fine and don't know that they've been exposed? And this virus is running rampant right now.
Wow.
So the different types of tests. I know there's one with the swab in your nose. I know there's one that's swab in your mouth. Is there a test that's more accurate? I know it's the antigen.
The rapid test is less accurate than the test. There's a test that you will take, and it takes about 3 to 4 days right now to get your results. That's actually testing for the DNA of the virus in your blood, in your body. So that's going to be more accurate. The rapid test is not, because it's kind of like detecting any piece of it potentially surface level. So it's not going to be as accurate. You're more likely to get a false negative with that than a false positive.
I'm noticing now that groups are, someone is coming up positive in a group, and they're only shutting down for like maybe 3 days or 4 days. So what is the thought process between them?
There is no thought process behind that, because if you have one person in a group that tests positive and you only wait 3 days for the rest of the group, that's not giving them enough time to even test positive. So now you don't know if the rest of the group is okay and or could potentially come down with symptoms or be an asymptomatic carrier. Everyone in that group that's exposed should be tested.
Okay, so it's really no thought behind then that 2 or 3 day delay.
Unless they're testing those people. But again, remember, 67% of those tests aren't accurate at that time. So if you wait 2 days and test everybody, you still are rushing it in terms of safety.
Okay, now I asked you a question. I test negative and I still feel bad. What if I test what if I test positive but not having the symptoms?
You should still
What my question is,
Okay.
should I test again a couple of days later or 3 to
if
5
you're
days?
positive,
Yes.
no, you should still consider yourself a carrier,
Okay.
because remember, a lot of people can be asymptomatic. So you should still give yourself 10 days since the symptoms first appeared or you tested positive until you go out.
And I was only thinking from the standpoint of you can test negative and be positive. Can you test positive and
You can, but why risk?
I understand?
So it's a chance that you can test positive, but I would definitely give yourself the 10 days if you can, away from people and away from exposing others.
Okay, so I've been around someone that called me and it said they tested positive. I should quarantine myself for at least 3 to 5 days before I decide to test.
Or not from when they contacted you, but from when you were exposed to that person.
Okay.
Yep. And what you need to also think about is who else did you come in contact with between that exposure and your notification? And that's what they talk about when they say contact tracing, because now you have to say, okay, I was around Michael on Saturday and now it's Wednesday. Who did I see from Saturday to Wednesday that could potentially now be infected? And that's where they lose track of the virus, because where did you go in those 3 or 4 days?
Mhm.
Did you go to the store? Did you go to the gas station? Did you go to church? Did you go to work? And then all of those people have now been exposed and everyone that they've come in contact with. And that's why it's spreading.
Okay. So let's deal with it. Someone in the house tests positive.
Mhm.
What should I do concerning the rest of the house?
The rest of the house, number one, should be considered in quarantine. The one person, so there's two things. There's quarantine and there's self-isolation. So that person that's infected should be isolated from the rest of the house. Because even you may not have already contaminated or exposed the others. So you want to self-isolate that person to one area. The rest of the house should quarantine from outside people or from being around anybody else other than the group of people in your house. So you have the person in isolation who's positive and the rest of the group who's quarantined from outside. So now that group, the five others or the people that are in isolation, we call it, should test after 5 days to see if they now have it or develop symptoms.
Now, how successful is that with the airborne virus?
Well, and that's why we talk about isolation. They can't use ideally the same bathroom. I have an aunt, my niece had it. Well, her niece had it, my cousin had it. And they literally gave her own bathroom and they set trays of food outside the door. And when they picked it up, they would use gloves. They followed everything to the T, and no one else in the house got it. So it is possible, but it's very difficult when you're dealing with children because they don't understand. Don't go by mommy. Don't go by daddy. You can't touch this, So that's where you see a lot of issues with that. But it can be done. But the reason why it does not always seem effective is because, remember, this person may not have found out until 4 days after that they had it. So they may have already given it to you before you isolated or separated. And now you say, oh, we did everything and I still got it. Well, no. When did you find out they had it, and what was the interaction prior to the diagnosis?
And that's the troubling part, because you can be infectious days before finding out you've been infected.
And that's why they keep talking about contact tracing, because there's so many variables that can misdiagnose people or miss opportunities to catch this infection between the time of exposure, especially if they don't know where they got it or when. And that's why people should stay home, because if you can say, oh, I might have got it here, or I might have got it there, or I might have got it this there, I might have got it from this person, you're doing too much, number one. And number two, you now can't really pinpoint when you were infected to try to protect others.
That's a mouthful. I mean, because the fact that you can be out and about infecting people or even getting infected and not even know it. I mean,
Yeah.
You can be infectious days before you find out that you're infected.
Wow.
So the best place is home. Okay, what is the chances of being reinfected after recovery?
Well, based on what we're seeing is, if you have been infected with COVID in the last 3 months, they're saying that you don't have to consider yourself at risk. Anything beyond that, they're saying you're at risk of reinfection again, based on what they're seeing so far. And if you think about it, even with the vaccine, which I don't want to go a lot
That's not
into.
true. That's not true. And only because it's the Alabama coach. This is the second time
having it.
before within the 3 month span.
But that's the general, and that's what I was about to say. That's the general guideline from the CDC. But remember, even with the vaccine that they're troubleshooting, they're already saying you have to get 2 doses before it works. And there's a time frame between the 2 doses. So if you think about it, there's no proof right now that the antibodies last or prevent you from being reinfected. So you should just consider yourself at risk no matter what.
And so for those of you that didn't understand what she was saying, I play a doctor on TV. The vaccination is going to come in two sessions. So you get one shot, and I think it's 21 days later or 30.
And then you have to get a second shot.
You have to get a second shot.
And they don't know how long it's going to be good after the second shot.
Exactly. They haven't, because the studies, they haven't even had a long enough time period to say, think about it, they just made this vaccine. So we don't have enough information to really go into. Yeah, but that was just an example in terms of timing and reinfection. Because,
and I'm going to throw this out there because this is my show. Due to the lack of information, it almost sounds like herd immunity. And I only say that because how are they going to go about it? Logistically, it's going to be a headache. And then who's going to come back?
Right. So now you have to deal with compliance. We already have people who won't take their regular
it's
medication.
30%. Compliance is 30%.
And think about it. If you get a side effect the first time, are you going to go back? You have people who had a sniffle from a flu shot 10 years ago and refuse to get it now. So if they have any indication that this is a problem,
so the numbers,
they're not going to get it.
I'm cutting you off because I'm getting old. I lose my train of thought. But the numbers is this: 3 out of 10. So 3 people out of 10 will go back to get their second shot. And we're in the industry. We're in the industry. So when you leave the doctor and he give you a prescription, 3 people out of 10 go and get that prescription filled. So it's very safe to assume that 3 people out of 10 is going to go back to get that second shot, to get the second shot. And that's why I threw it out there. It kind of sounded like herd immunity, only due to the fact of the numbers and the stats of how things is going to work out.
Well, and just to clarify, herd immunity is not a bad thing. It's how you get there. So because for things such as polio and these different diseases like that, you can say, oh, there's herd immunity because there's enough people protected to prevent it from being a pandemic or spreading amongst the general population, because now we've basically eradicated it through vaccinations and or exposure. That's what herd immunity means. But with a virus like this, you don't know that herd immunity is possible, because if you can get reinfected in 3 months, that is not immunity. That's temporary. Just like with the flu, you don't hear anybody say herd immunity with the flu, because every year this virus changes and you can be reinfected. So I don't think there's a such thing at this point of herd immunity, because the virus is continuing to change.
Well, let me change my terminology. I was trying to be deep. It opens up the door for a whole lot more people to die.
Oh, absolutely.
To be that don't have to be, but it opens the door for a whole lot of people to die. If I can take the flu shot and go home and give somebody the flu, I guess that's all I say.
I got you. Yep.
So you a doctor, right?
Sometimes.
You went
Depends on what you go to.
You went to Butler, right?
I did.
Graduated from Butler. Should we be having church?
No.
You a pastor's wife.
I am. And I love my church. I love my church family. I love my pastor. And I miss my church family. But I love them enough to tell them to stay at home. Because I know what this virus can do. And we have a lot of seniors in the body of Christ. So when you look at it in that regard, with underlying health conditions, African Americans already being at risk, why would you take a chance on spreading a virus that could potentially kill off the members in one Sunday? All it takes is one Sunday. Just like they say, Thanksgiving, one dinner. There was a family that had a birthday party and half the family died. So if you think about it in that way, is it worth it? We can pray for them. We can love them. We can do virtual. There's a lot of things we can do. Send cards and still be connected while being safe.
What do you think about this time off, these 2-week recess, if you will? So someone at church catch corona, the pastor say for the next 2 weeks, we're going to take off.
Okay.
What do you think about that?
That is the CDC recommendation. If there's an exposure, you should stop.
But
What are those people doing in that 2 weeks? Just because they're not going to church does not mean they're quarantining. So are they still going to work? Are they still around other people? So it's still, as you was, a slippery slope, because they still may go home and die during that 2 weeks off. So that's not solving the problem. And if a person gets exposed in another manner during that 2 weeks and comes back, you're still in the same position. So it does not solve anything to do a 2-week break when people are still living their lives outside of church. Now, if you said, okay, everybody's quarantined prior to service, during service, you know what I mean? There's no way to be able to know what people are doing Monday through Saturday before they come to church to know if you're safe. And you say, okay, we'll do a rapid test during service. Okay, well, 67% of them may be accurate. And what about the others?
So the safest place at this particular time is at home. I do know for the NBA, they experimented with the bubble, and they had all the teams meet at one spot. They had no outside interaction, and I don't think they had not one positive test for 3 months. But they were quarantined in one spot, nothing coming in, nothing going out, and the virus needs bodies. And I'm mighty afraid we are providing the virus with bodies, even with church. I mean, at this particular time, it's so much that we don't know. To have churches is irresponsible. I get it. I'm a pastor, but it's just so much that we don't know. It's irresponsible with the airborne virus. It's just too risky. Leaving your house is risky. To leave your house to go to a setting where you don't know where your brother or your sister been.
Even if you do know where they've been, you don't know who they've come in contact with or
who they've been around.
It's just too many opportunities for
and then
failure.
the 6 degrees of separation. I mean, that's really close if you look at it. Because, we had in our family, the healthcare provider was positive. Gave the whole family corona. Now you would think that you wouldn't catch it from your nurse.
And that's the scary part. You don't know where you can catch it. If you could see it, that would make it so much easier. We have patients in a particular nursing home, and we took on 10 patients. In less than a week, 8 of them became positive, and 3 days later, four of them died. So you can imagine how fast this virus is moving, and there's no control. There's no way to say what the outcome will be in an individual.
And that's within a 2-week time. And that's with having a bubble type situation, because you're not just walking in
So the nursing
in the nursing home. So that's almost internal. Since November 1st, 4 million people, since November 1st to today, 4 million people, 4 million new cases. Now, that's really not counting Thanksgiving.
No, not at all.
They say Thanksgiving is going to bring on a whole new surge.
Because remember, we talked about the time frame. So now Thanksgiving was last Thursday. 3 to 5 days before you could even potentially test positive, and up to 14 days for you to display symptoms. So we won't see the peak from Thanksgiving until 2 weeks after. And that's when we'll know what the effects were. And 3 million people traveled.
So we have so much to be careful for. We have so much to pray for. Again, we thank you for tuning in. Sister Carmen Lugo, we thank you for tuning in. New Jerusalem, we thank you. If you have any questions, any comments, please write it in the chat room.
We saw they did a special on Inside Edition, and they went into an airport with invisible ink, and they marked chairs, doors, handles, just the counter where you check out, and it wiped off with just water. And they went back 3 days later, and all of the spots that they marked were still dirty. So they're not, and that was current. So they're not cleaning. And you have 3 million people going through.
Well, we talked about it 4 months ago, 5 months ago. You couldn't even walk in the store without they spraying the card and handing you a wipe. Now they just put a sign up and said it's been sanitized. And so, I mean, you know, again, when you leave the house, the chances of you catching this virus is high. When you travel, it's high. When you go to church, it's high. When you go to the store, not just church, when you go to the store, it's high. And then you will see increments of shutdown. I don't think it'll be another complete shutdown the way it was a few months ago. So you will see the restaurants taking out seats and limiting the seating capacity. You will see the bars close at 9 or 10. The bars will close early, but a shutdown will never happen, and so we have to shut down. I thank God for New Jerusalem. I thank God for the members that understand the time and the season, and you know, we pray for you, we miss you, but at this particular time, we cannot feel safe in meeting. And I'm a church boy. I'm COGIC to the bone, and the COGIC never shut down. We shut down. We didn't shut down for holidays, you know. But at this time, it's not. I don't feel safe in having service as we know it. And so until that time, we will continue to stream. We will continue to bring you program and give you information that you can apply to your life. I don't want to be another news engine. We have a doctor on staff, and we just not throwing information out there. This is information we have studied. We work in the health industry, and we see the effects. We have clients that has came through, tested positive, had corona, been in the hospital, came through, made it through safely, and we still yelling at them through their door. So we don't take this lightly, and we don't take the saints lightly, and we want everyone to be healthy and well. But until things get better, we just have to take extra precaution. This is the 12th month, and we getting kind of lax, getting kind of lackadaisical with our methods, and we need to stay on top of it, because any surface could be infectious, whether that's at the grocery store or at the gas station. A handle, any surface can be infectious, and so we have to stay on top of it. Even in this winter season, we have to stay on top of being careful. God bless you, Lady Jackson and Pastor Jackson. We thank God for you. And then God is going to get us through this.
Yes.
There's nothing we can do to keep ourselves from getting corona. Even staying at home, it's airborne. I don't want to get deep, but your neighbor can sneeze outside. And it'll be a heavy wind, and maybe that's too exaggerated, but even staying at home, it's going to keep us. God is going to keep us, and so we have to put God at the head of our day. Let's talk about hand washing. what is the proper process in hand washing? Because remember, we needed that antibacterial soap, and it had to be 99.9. Now they say just get them wet.
Just shake them off.
So I mean, from February to now, so much has changed.
Oh,
Remember, they were saying that don't wear the mask, and then they said wear the mask, and then they were saying that the mask would just protect you from me. Now they're saying that the mask even protects you. So I mean, it's just so much to be said. So what is the proper method now with the hand washings?
You want to start? Okay. Sorry. I would definitely say number one, you still need to use soap. There are some places that are asking if they just can use water, and water will not do it alone. It doesn't have to be antibacterial soap, but it needs to be soap. And you need to wash them for at least 20 seconds. Some people say sing happy birthday or, ABC, something to give you kind of a general length of time that you are washing. And another thing is making sure that you rinse downward and let the water drain towards the bottom of the sink, and and you're not using a towel that everybody else the whole day has used to dry your hands. Try to have some type of disposable napkin that you're going to dry with, and turn the water off with the paper towel. If you wash your hands and you touch a dirty sink knob, you've negated the entire process. So it's very important to get a good washing, both front and back. And you rinse them very well, and then you dry them with a clean paper towel and turn off your surfaces. Turn off the water with a paper towel, and then use it for the knob on the door to exit the bathroom as well. The least exposure to surfaces as possible is best. If you don't have access to water and soap, then that's when I would recommend the hand sanitizers or the rubbing alcohol. We have rubbing alcohol in a spray bottle in the pharmacy as just a quick, like if someone comes in and they need to use the pen pad or something, we will spray their hands with alcohol before they touch surfaces and things like that. So that's always a quick thing. And alcohol works well because it dries fast. It won't leave a residue or damage any of your equipment. It'll just be a quick fix, to at least clean them as best as possible. Anything I missed?
no, and that's why I didn't have anything to say, because I've been asked several times, at what point is a virus killed, or is it killed? Does it rinse out in the sink? So that's,
It's rinsed off. It's not killing it, and that's why you're washing it for a period of time. You're removing it. There's surface agents that trap it, and it's removed from the surface, and then you rinse it down the sink. These aren't killing it. You're just getting it off of your hands, and that's why it's very important to not recontaminate or put it back on your hands touching things. Now, there's things that kill it, but you're not walking around with bleach and sprays like that, and you don't want to put those on your skin every time. You're going to damage your skin. Over drying, there's things you have natural bacteria on your skin and in your body that you don't want to overkill. So it's important that you wash your hands, but you're not killing off entirely your natural bacteria. And people are doing that. They're causing cracks, especially in the winter. It's important to have a good moisturizer with you to try to keep that applied. Aquaphor, Eucerin, those are very good moisturizers to prevent your hands from over drying, because that's also a big risk.
God bless you, Minister Marsh. God bless you, Mother Marsh. Minister Marsh said, what is the best mask to use?
Well, an N95 is the best mask, but it's very hard to get. And there's actually a proper fitting protocol that you have to go through to wear that properly. So while it's the best, if it's not fitted properly, it's not going to do you any good. And they actually do a test that you run in place and you have your head in this almost like a bag to see if anything is expelled. When you have that on, to find out which one fits you best. But if you can't get that, anything with a filter is going to be the next best thing. You're not finding a lot of those. When I go in the store, I'll put on 2 masks, just the regular surgical mask, just to try to give myself a little bit more protection. But it's very hard to find with everyone making them. So just read the cover and see if they have a filter in them. That's going to be your best bet, and it should be one that's changeable, and then you can wash the mask and change your filter. So when you buy the mask, look for the filter. It should be close by, and buy a pack of those too. If you leave the same filter in there for a year, you're not doing yourself any good, because now that's dirty too. So that's what I would say.
Look, I have 2 questions. First question is they're coming out with a 3-layer or 2-layer mask, but how's that?
That's just giving you, and that's kind of the filtration process. It's giving you more of a barrier, and it basically reduces the size of particle that can get through to the inside from the outside. So each layer kind of traps its own particle size per se, and the more you can have a barrier, the less that will get inside. And that's why I said I'll double up, because that's now basically 4 layers. If the one is 2 and the other one's 2, you have 4 layers of protection from you and the outside. Not 100%, but better than 1. And Mom talked about the rhinestone ones that you can see through. I love them. But when you see me have them on, I have a mask under the mask, because that was cute. But put your surgical mask underneath it to protect yourself, and then put the other.
Now tell them how hard it is to breathe with that N95.
Oh, not only is it hard to breathe, your ears will be raw. We wear them for a lot of the healthcare providers wear them, and it's not anything like the blue mask. It's definitely almost like you've been running, and it's you're forcing the air in or out. And it's very tight, so you see marks on the top of your nose and on behind your ears, or however you have it strapped on. A lot of them now put them up on top of their head because the ears are so sore, and noses have sores. But it's worth it if you're protecting yourself and your loved ones. But the real mask is definitely hard to breathe when you have the right amount of coverage.
And then how do I properly clean my mask? Especially those 2 and 3 layers, too. How does that?
Well, the filters you should throw out and change. The filters are usually not cleanable. The mask itself you should wash in hot water. And if you have the capability of drying it at high heat, just to give yourself as much protection as possible. A lot of these cheap masks are going to shrink, and then it'll be for your child when you wash it. So, and they're cheap now. I would recommend replacing it often. If you can't wash it, just buy, a lot of them now come in 3 or 10 packs, and just switch it out as much as you can.
The other day I was driving, I saw a guy, and he had like a whole glob of masks on his rearview mirror. And I guess he just pulled one off to go in the store. Now, how safe is that?
It's not, because and I know we've all done it. When you're in a rush, you grab the mask that's just laying there. But that's defeating the purpose, because Mom has made it very clear the outside of the mask is now contaminated, because when you think about it, whatever you're protecting yourself from has touched the outside of the mask. So when you remove it, if you're not going to wash it, you need to throw it away. If you leave them hanging, they're collecting the germs. A passenger gets in with COVID and coughs, all of those are now contaminated, and then you put it on. So it's very hard to stay completely safe like that. I do see people keep them in like Ziploc bags, they're extra ones, to try to keep them as clean as possible when they need to switch them. But it's just hard. And they sell lanyards for masks now, and you take it off and it hangs. I mean, okay, now your whole shirt was dirty before you hung it down there. It's really cute, but it's defeating the purpose.
And so we have to be mindful of all things. When you leave the house, you have to, and again, we talked about it, just having a plan before you leave the house. and stick to that plan.
It's very hard because now we're coming into Christmas. So we've skated through Thanksgiving, hopefully social distance and not met with family. And now you're looking at shopping for Christmas. And what do? Online, order it and leave the boxes and let them sit a couple days before you get into them. There's still good deals and still ways to shop. And my husband will tell you because I'm getting a lot of boxes, but it's still, because I get it. I love Christmas. It's my favorite time of year, but it's not worth it to be out and risk your family.
And, this year we're going to do a lot of celebrating the real reason for the season. It's not about the gifts anyway.
No.
It's not about the turkey, And I just think this time is giving us time to get close to God, but then reevaluating our life and putting things back in its right order. I think we have gotten numb in the process of running and trying to meet obligations and do things. We just really got numb to what really is important. And I think this time, I think God is allowing this time for us to recalibrate and get back to what's important and what's necessary. And you will find out, or we will find out, what we thought was important and what we thought was a necessity really is really not. And I believe the hand of God is moving. It's marvelous in our eyes. We dare not complain. But I think God has given us an opportunity to get close to Him, to draw nigh to Him, and to see what He wants and has for our lives. We thank you all for tuning in. Do you have anything else? We thank you for tuning in. We hope that something was said that you can apply to your life. This is some hard times. It's some rough times, but God will bring us through it, and God can help us through it. And we don't cry and complain as if we have no hope. We are not without hope, and we have the hope of glory in Jesus Christ. And so we just thank God for you. We thank God for what God is in our life. We place Him at the top. We thank you all for tuning in. We ask that you would be a blessing and a help to this ministry. If there was ever a time that your church needs you, it is right now. And we ask that you'll be a blessing to this ministry. You can do it through the mail, on Square, or through the Cash App. And then we pray that God will bless you tremendously. Again, it is with Jesus Joy. We come to you from the store of Healthy You, and all is well here. We miss you. Mommy has a saying, her unit of measurement is 2. And so we missed you too much, and we love you all too much, and we can't wait to see you. But until then, we just want you to be safe, and we want you to stay blessed, is our prayer. So until next time we see you, God bless you. Thank you. We love you.